Welcome back on this Wellness Wednesday. Receiving care at a hospital can be a secure feeling as you know all your health needs are being met.
Yeah, but today we're looking at what happens when you head home after you're released. Rachael Rivero from Kansas Care Connect is joining us today to talk about the hidden risks after a hospital stay. Rachel, great to see you. Thanks for being here.
Yes, thanks for having me.
I know that a lot of people end up in the hospital, even if you're admitted, and then you get sent home. And most of the time, I feel like you're not completely healed, and there are things that you need to do once you're home, whether that's, I don't know, changing a bandage or just monitoring other things. And it can be really scary.
It's very scary, and anymore they get you out of the hospital faster, and so you're not fully well yet. And then it's, they send you out and you're already not feeling well and maybe overwhelmed, and it's a scary environment. And so you're like, I don't even know what's going on, and you don't really absorb all that information that they give you when you're still there. Hopefully you have a caregiver, somebody with you who could absorb it a little bit more, but they're also scared and they don't know what's going on. So you get home and then you just get this like, oh, now what do I do now? I still don't feel good, but what changed? So whether it's medication changes that they're like, oh, I didn't realize that all this, sometimes they make a ton of changes, and it can be really overwhelming. And so that's what we're here to help with, is try to make life a little more simple and feel like you have some good support on hand.
Yeah, I'm sure that this is very high risk for a lot of those individuals. And where do you tell them to turn to?
So our service, Kansas Care Connect, is one. We're nurses and nurse practitioners that help coordinate that really critical time after hospital, but really every time in between doctor's office appointments and things where those changes might happen. But really looking at things like making sure you have those follow-up appointments scheduled as soon as possible so that you can get in and see your providers after something like a hospital stay, so that you make sure you're doing what you're supposed to do so that you don't wind up back in the hospital is a big piece. And just making sure you have your support system, whether that's family, friends, caregivers, or your providers even. So just making sure you touch contact with all of those people will really help. So.
Do a lot of people end up back in the hospital?
Yes, it happens more often than we would like, for sure. And a lot of it is very preventable.
Yeah.
We also do things like remote monitoring, where we can monitor weights and blood pressures and blood sugars and things like that. So that's one of the benefits of our service, and having somebody with experience on the inside that's monitoring those things in real time, so that if we see a trend in the wrong direction, we can catch it before it becomes really bad and you're back in the ER.
Yeah. You might have touched on this a little bit at the beginning, but what would you say is the most challenging thing that people face after they leave the hospital?
Just knowing what to do and what the plan is. So what medications were changed? What did I need to stop taking? What do I need to take again? What prescriptions do I need to pick up? What other, whether it's I had a surgery and what do I do now? When do I change those bandages? When do I need to see a provider, and which ones do I need to see? Because like we talked about before, a lot of times we have a lot of providers. You have your primary and then maybe multiple specialists, and maybe you picked up a new doctor or two while you were in the hospital. So knowing who do I actually need to follow up with, who do I not, where do I start?
Yeah, and even if the hospital gives you, I don't know, like an instruction list, it's got all the medical jargon, and it's hard to even decipher what that means for, people that are not medical professionals.
Right.
It can also be hard for caregivers, right?
Very, very much so, because it's also very generic usually. It's like the same thing they print off and hand to everybody, so it's not very personalized. Whereas when you have somebody like a care coordinator, we know these patients, we know what's going on with them, we know their life scenarios, so we very much personalize those things, and we know kind of what their area of struggle is going to be, what we really need to focus on more. But we also know their providers, so we know who to get in touch with, we know kind of how to work the system for them, so it takes a lot of stress off of the patient and their caregiver or their family.
Yeah, it can be a lot to deal with, for sure.
Very much.
Just any words, for these people, any additional support that you want to mention?
Just check out services and resources that are available. Things like my company, Kansas Care Connect. It's available to anyone in Kansas that's on Medicare. We do have cash pay programs and things for people who aren't on Medicare, but it is a Medicare covered service, so it's great to have that resource available. But if you don't have access to something like that, just make sure you surround yourself with support and have caregivers, and just feel free to ask questions. It's never a bad thing to ask questions. I tell my kids that all the time. the worst they can say is no. So
Yeah.
always great to ask.
And no question is a bad question either, especially when we're talking about medical things.
Yeah, if
So,
you're not sure, just ask.
Yeah. All right. Well, Rachel, thank you so much for being here. Thank you for what you're doing. Hopefully people out there can take these tips and get the help that they need, because it can be a really tricky thing, but we appreciate it.
Yes, of course. Thank
Yeah,
you.
thank you.
We're going to have all the details on Kansas Care Connect and how you can get help with this interview on our website at cake.com/guests. We'll be right back.